All right, everybody, ready for a deep dive into the future of healthcare? We're talking AI and whether it's going to replace doctors.
Hmm.
Big question, right? We're looking at this Kellogg School of Management article. Strategy professors break it all down. So picture this. It's 2070, you walk into urgent care, but there's no receptionist, just this super smart AI guiding your whole visit.
And that's not as far-fetched as it sounds. AI is already analyzing tissue samples, reading scans.
It's already happening. This article, it highlighted data-driven treatment. What's that even mean?
Okay, imagine AI going through tons of data, medical journals, trials, even your history, to figure out the absolute best treatment just for you, personalized based on your genes, everything.
So AI crafting my treatment plan more than any doctor could handle.
Exactly. And then there's diagnostics, which the article goes into. AI trained to see diseases in scans, maybe stuff doctors miss.
That's kind of impressive, but also a little scary. If it's that good already, are doctors done for?
Well, that's the million-dollar question, right? Does this mean goodbye, doctors? Hello, AI. The article says, not so fast. It's more likely AI will be a really powerful tool for doctors to help them do their jobs even better, not replace them.
So partners, not replacements, that's reassuring, but the article did mention AI winning in some cases,
Oh,
right?
absolutely. One study, they were looking at early breast cancer detection with mammograms. And the AI they trained, super accurate, even better than radiologists sometimes.
Wow, that's huge. Catching cancer that early could be life-changing.
Exactly. Early detection is key. But it's not always about AI being better. There was another study about diagnosing hip fractures.
Yeah.
And the AI worked best when doctors used it with their own expertise.
It's like a second opinion, but from a computer that's seen thousands of cases.
Exactly. And this is a big point the authors make. Even if AI gets really good at these technical things, reading scans, all that, there's still that human element that's really hard to replicate.
You mean empathy, actually connecting with the patient? That's not something AI can do, at least not yet.
Exactly. Building trust, understanding their worries, offering support. Those are things human doctors are great at.
Okay, so maybe this AI doctor team is the way to go, each using their strengths. But what does this all mean for healthcare in general? Costs, the whole system. That's where they talk about this healthcare value chain,
Right.
right? I have to admit, sounded a little jargony to me at first,
Yeah.
but they explained it well.
It's basically just all the different players in healthcare. You've got patients, obviously, but also the doctors, the hospitals, insurance companies, even the drug companies. Everyone's connected.
Okay, this whole web of people keeping us healthy. So if AI takes on more, like we've been saying, diagnosis, treatment plans, what happens to everyone else?
Well, that's the big question the article tries to answer. Do doctors become less important, their skills less valuable? Or could it go the other way? They become even more in demand because AI makes them super efficient, see more patients, do more with the tech.
So AI, best thing ever for their career, or the worst.
And what's interesting, the article suggests doctors themselves might not see huge salaries from this, at least not right away.
Really?
Yeah, it's more like the whole system might benefit. Hospitals could be way more efficient, maybe costs go down, quality even goes up.
Okay, so good for healthcare overall, but not necessarily a big payday for doctors.
Right, exactly. But here's where it gets even trickier, the article asks.
Mm.
What if AI means fewer procedures?
Fewer.
Yeah, like what if AI helps diagnose things so early that you need less invasive treatment later on?
Which for patients sounds great, right? Less poking and prodding.
Exactly, and this is the dilemma, if healthcare makes money by doing procedures, will they really want AI if it means less revenue?
Wow, it's like I don't know, a double-edged scalpel, this whole thing. AI could make things better, but our system might not be ready for it.
Yeah, it's something to think about for
A
sure.
lot to think about. If AI is going to change healthcare for the better, we got to make sure everyone's on board, patients, doctors, the whole system, right?
Absolutely.
Well, on that note, everyone, check out the full article, Kellogg School of Management. It'll really make you think. Thanks for joining us for this deep dive. Until next time.